Good morning. Today I'm going to do a demonstration video for my bowel program and bowel program for a person with Therafin tools. This is a Therafin magic bullet inserter available from your occupational therapists. I went to Craig Hospital, so that's where I got mine. I hear they're not cheap, but your insurance, I think, will cover it, or your inpatient provider should give that to you before you discharge. So, step one, there's a handle, little peg on the bottom, and a strap with some holes in it. So, right hand for me, that's my dominant hand. Both hands have an equal function, but it's one I use. So I stretch that strap with my finger and then put that little peg in one of those holes. You can see that. And that holds the strap on my hand tight. Make sure that your tool is kind of straight upright. I like mine to be perpendicular to my hand like that, if that makes sense. So the bullet inserter works. There's a spring underneath it, and you can see the little plunger pushes up, and that pushes the magic bullet out. I have one paper towel napkin. It's called a Covidin Kendall white washcloth. It's just kind of like a napkin, but maybe more cotton, so it holds together when it gets wet. I get them really wet for washing or wiping myself. So it stays on my hand. One nitrile glove, size small. Most important thing to remember is size small, use the pinky finger. Nice and tight on the tip there. Tube of lube, your favorite brand. Mine is Medline. See that? It's called Easy Lubricating Jelly. And magic bullets cut in half in a Tupperware. Easy for me to open. I can give it a little twist, usually. And that'll be the day where I can. But sometimes easier to do without the tool on your hand. I'm over the toilet with the seat up. I have a short toilet. Short toilet helps to reach the tool underneath easily. I need to open this, hold on. Okay, ta-da. I'll take the top and I will dump one magic bullet into the lid, put the other one up on the shelf in front of me so it's out of my way. Now, back to the tool. Again, putting it back on. Now, glove. Putting the glove on. Like so. Sometimes I gotta use my mouth. Don't be afraid, gloves clean and sterile. So I'm sliding the finger, pinky finger again, on, slide it all the way down. See how that looks? And then when you pop it back up, it makes a little depression. And that's real nice for slipping that bullet in there. There's two ends of the bullet to use. So I'll show you both, because when you cut them in half, you don't have to use the other end, but I do because I'm frugal, and they seem to both work the same. Okay, I've got the cut tapered end. See how it's skinnier on one end? The skinny end needs to go in there. Or you have what I call the pointed tip. And the pointed tip should go down in the inserter if that's the one you're going to use today. I will show you the tapered end because that's the easiest one to put in. And it stays in the best as you're getting started with your trying this stuff. My friend at Craig that I was talking to about this that gave me this idea. So left hand is not as good, obviously, with my right, so I'm going to struggle probably. Drop it. get it lined up, it's real easy. Okay, you see how I got that in there? Took me a little bit, but I got it lined up. It's just kind of in there snug right now. Here's the ticket, the trick. Take the top hat edge, you see that? My finger's underneath it. That way it holds the spring mechanism so it doesn't depress. Put that on the hand rest so that it doesn't go down. And then I take this hand and I just give a little love tap to kind of smush it in there nice and tight. Got it? You can see it's down there a little bit better. And it still comes out just fine, but it won't fall out on the way underneath you. So practice makes perfect, obviously. Use a mirror to look underneath you. They make floor mirrors that adjust so you can see your bottom underneath you and where you're aiming for in the beginning. Start out over a low trash can, gives you a lot more visibility. You can start out over the floor just to make sure you don't have anything in the way and you get good visibility, good lighting until you get it down. I do not use a mirror anymore. It is all by muscle memory and feel. So I have enough sensation that I kind of know when I hit the mark, if that makes sense. Now, lubricating jelly. Flip the top open with your thumb. Take lubricating jelly, put it on the hand rest the same way. And I use that to basically push some out. Get it all over there, a nice liberal amount, like that. Now this is another important step. Make sure that you lubricate the entire body of the tool so that the glove does not stick on its way out. When the glove gets stuck inside, it makes it real difficult or it falls into the toilet. So there, got it? This is where I use paper towel, wipe my finger off, excess lube, and now you're ready to insert. So, this is taking me 7 minutes so far to explain this. Normally it takes me about 2 just to do it. So, it'll come in time. Again, make sure your inserter is perpendicular to your hand, and you go underneath and insert magic bullet. That's it. Good luck. Okay, I'm going to show you my bathroom setup as well during my what it looks like during my bowel program, so you guys have some ideas of where to set things to be as efficient as possible. I've had the opportunity to design this bathroom so it is built around my needs and abilities. It was a half bath, so it's small space, just mind you, that we adapted and added a shower to, a roll-in shower actually. My friend Brandon Lewis really knocked it out of the park with this one with a lot of help. So bowel program. Coffee, water. My blood pressure falls in the morning, so I drink lots of water. All right, magic bullets pre-cut. I usually cut 5 at a time, so I've got 10 days worth. In a little Tupperware with a screw lid that I can get off of there real easy. Stack of paper towels / wipes. These are from Coviden. They're called Kendall white washcloths. They're over here, just a stack of them, you can see. That's what they look like. Sorry for the swaying. But those are great. You get them wet and wipe post program. Other supplies over there, I've got some extra lube. I've got some extra baby wipes. I've got hydrogen peroxide cleanup wipes and some soap. And then obviously some other supplies. Gloves for everybody else. A glove holder. Not really necessary, but we do use it from time to time. You can see the door is very close to me. I have to back in here to get over the toilet and then close the door behind myself, which is fine. It's a little slower, obviously, but if I get help, it goes way faster. There's my feet, Crocs, best shoes ever for showering. I keep a trash can right there. That way it's close for depositing dirty gloves off of my Therafin tools. The sink that I can reach with a single handle, and I can wet my paper towel. That's what one of those paper towels looks like. I open them up and fold them because of my hands, right? I have to get them on the edge of my hand, and then I get underneath myself and wipe. A detail mirror for shaving because I can only roll so far underneath this little corner sink with the trash can there, but it works good so when I'm shaving trimming my beard, mustache, whatever. Sanitizer, soap, basics. Again, this little shelf has been super handy. I've got a towel in front of me if I need it. And then up here, there's a glove holder. And on top of that glove holder is my tube of lube. That's just where those things live. So like I said, small gloves for doing program. And then this, just a little washcloth holder from Home Depot or Lowe's or whatever. But that holds my tools real handy. I can just keep them back there out of the way and grab them when I need them during my program. And then behind me, I got a heated towel rack, which is totally sweet if you get cold in the wintertime. It hasn't been bad here. The weather's been really favorable in Denver, but in cold climates, warm towels really do help you as you get out of the shower. Stay warm. And then over here is the shower. Come on, focus. Shower, here's the shower. So you can see it's rolling, it's just wide enough for me to get in there, and I back into that. So the process is I roll out the door, back in, close the door behind me, roll into the shower, back into the shower, and then I'm in there. And there's a couple bars with a washcloth and a normal sprayer handle, but big enough for me. I could get you dimensions if you're interested, just ask for it. So there's my bathroom and how I am set up for my bowel program. Send me questions, post in the comments. Check me out on Instagram at Michael Manhardt, and you can send questions there too in the comment sections. So, enjoy.